Hello, welcome to my channel. In today's video we're going to be talking about polycystic ovary syndrome and skincare. If you've not been here before, I am the Skin Connoisseur UK. I'm a final year student nurse. I'm also an aesthetics practitioner, and my channel is everything to do with aesthetics and dermatology. So if that's what you're into, do have a look around and also subscribe. So in today's video, I really want to focus on how you can manage and maintain healthy skin if you do suffer with polycystic ovary syndrome. It's a very common condition that can develop within your early 20s usually, and the NHS does say that this can affect between 1 in 10 women. Polycystic ovary syndrome can also be hereditary as well, so that is something to look out for if you're aware that it may run in your family. So as a female, you will have something called ovaries, okay? So ovaries are of course within the uterine area, and within the ovaries there are something called follicles. So these follicles allow for eggs to be released every month, which will then give you your period. So when these follicles do not develop properly, an egg cannot be released, which then causes polycystic ovary syndrome. Common symptoms of polycystic ovary syndrome, so if you do have these, do look out for them. You will have an increased levels of androgen, which is the male hormones which produces testosterone basically, and a byfactor of this is increased like facial hair. So some women with polycystic ovary syndrome, they tend to have hair that grows on the face within the chin area. Other common symptoms of polycystic ovary syndrome are missed periods or irregular periods. This also includes weight gain, hair loss, and acne. So polycystic ovary syndrome, it is a hormone related condition. So if you do suffer with acne, for example, you do need to treat the base cause of your hormone problem basically. So hormones, it can be treated by going on the pill. So by going on the pill, this basically helps to increase the estrogen levels that are within the body, helping to balance out the hormones and regulate everything. In addition to the pill, there are also other hormonal contraceptives that you could try, like the implant, or there's also the coil as well, which is the IUS. So this comes in the form of the Mirena or the Kyleena, and these tend to last up to 5 years. So before moving on to, treating how polycystic ovary syndrome can display itself, you really do want to be treating the foundation first, which is the hormonal problem as mentioned. So it's quite good to book an appointment with your doctor, do some blood tests and stuff like that, and then take it from there. Okay, acne is a very common factor of PCOS due to the increased levels of sebum production in the body, and this is often due to the increased amount of the male hormone in the body, which can make the skin oilier, thicker, and your pores also appearing larger as well. So there are many products that we can use to help tackle this. So the first thing you want to do is introduce a vitamin A into your skincare routine. So this is your retinols or your tretinoins. So what this actually does is help to speed up the cell turnover, and by speeding up the cell turnover, you're minimizing your skin's cell turnover cycle. So by minimizing this cycle, you're helping to speed up the exfoliation in the skin, which is going to help to unclog those pores and also increase the collagen production as well. So that's going to really help to tackle the acne and the increased oil that's already on the skin. Next, you want to introduce a serum into your skincare routine to help control the oil production. So niacinamide is amazing for this. I tend to use the one from The Ordinary personally, and what niacinamide does, as well as helping to fade any scars or hyperpigmentation, it's actually really good at helping to control the oil production on the skin as well. So this is a serum that you want to look into and incorporate into your skincare routine. Another is incorporating like acids into your routine, such as your salicylic acid, which is also effective at helping to control the oil on the skin as well, which is going to help to unclog the pores and prevent and limit any acne from building up with this condition. Also, I go on about it a lot, but you do need to use an SPF of 30 or above, okay? So what your SPF is going to do is protect your skin from those harmful UVA and UVB rays, which is going to penetrate the skin and speed up, you know, fine lines, wrinkles, sun damage, hyperpigmentation, and a host of other skin conditions. So having polycystic ovary syndrome, your skin is already prone to breaking out and having acne. So when these spots are on their way down or fading, etc., you need to be using an SPF basically to stop any scarring, stop any hyperpigmentation, and just generally protect the skin, as it is very sensitive during this point. I do also recommend double cleansing in the evenings. So double cleansing is a fairly simple process. You just want to cleanse the face twice, essentially. Think about when you're going out throughout your day, the pollutants, the smoke, the harmful environment, all these things, makeup. You just want to get it off your skin so your skin can breathe and exfoliate well with your vitamin A that you will be using. So do double cleanse. There are many options out there. You can use a gentle cleanser and then a more harsher cleanser second time round, or you can use a cleansing balm and then your choice of cleanser. Basically just make sure that you are cleansing twice, and that's really going to help with the oil production on the skin, as well as help your vitamin A to work better. I'm sure you've seen it before when you've wearing makeup, you're wearing a full face of makeup, you rinse your face once and then you dab it on like a white towel and you literally see your face printed out on the towel. So just make sure that you are double cleansing. Last but not least, we're going to explore some hair removal techniques. So I wouldn't entirely recommend waxing, although waxing is, you know, a fairly good treatment if you're just starting out. Waxing can be very painful, and on somewhere as delicate as the face, you don't want to risk causing any more scarring to that or any damage to your moisture barrier, because waxing actually ruins the integrity of the skin basically, which can then compromise your moisture barrier. Also, with treatments like electrolysis, it's not always the best, particularly with black skin as well. So for safe and effective hair removal, do look into laser hair removal. They often do packages as well for like lip and chin, for example. So I used to work in a laser clinic, and there was a particular laser that they used to use, which is called the YAG, and that was for people with like olive to darker skin tones. So if you do have dark skin, do see if they have this laser or the soprano ice, and this is going to be really good at helping to basically get rid of the hair and even probably stop it from growing the more you do it over time. So these are really effective methods of hair removal that you should look into if you do suffer with PCOS. When going to your laser consultation as well, when you are like trying to discover if their machine is best for you and stuff, do have a look at some of their previous work, see if they've got any pictures of people that have the same skin tone as you and the results that they ended up with in the end. Because although it's not quite common, it can happen where people with darker skin, they do get laser treatments, and what does happen is the hair can come back thicker and coarser, or you may experience some degrees of hyperpigmentation because that laser is not the best for your skin, or maybe the therapist just doesn't have enough knowledge on how to treat people with your skin type. So that's something to, of course, look out for. So this was a bit of a whistle stop on PCOS and how to manage the symptoms of it in regard to your skin, etc. So if you did like this video, give me a like and a thumbs up, subscribe to my channel, and I'll see you guys soon in my next video. Bye.